Yeah, all right, we live, man. I want to welcome y'all to the Daily Medicine today. It's something that touches, I believe, all males' heart, real close. Because I know a lot of it hits home. It hit home to me twice with my grandmama and my mom, and my mother. And I know a lot of ladies who went through breast cancer, and it's hitting our communities very bad. So we're gonna talk about breast cancer as much as we can today, because like the doctor just told me, it's a real in-depth subject to learn from. Can't do it all in one show. So we're gonna give you as much as we can, and we'll give you some resources to go to get more information. You can go ahead, Doc.
Hey, all right. Well, it is October 1st. It is Breast Cancer Awareness Month. And so, probably, Nate, what we need to do is probably do this a few times over the course of this month. Because, yet again, breast cancer is a big issue, not only within certain states, countries, it's a worldwide issue. And in this country, it really does hit every family. You know, a lot of people know somebody, or unfortunately know a funeral that they've gone to because of breast cancer, or they know somebody that survived it, because we do live in 2020, and what we're doing now is saving a lot of lives from this dangerous disease. Okay.
Right.
Uh, and we always try to keep the social aspects in this show very current. When it comes to breast cancer, Caucasian females tend to get that more than most other ethnic groups. However, the mortality or the death rate tends to be higher in African American communities, and that's a big disconnect. Okay, so it's basically saying if you're one race, you have a bigger chance of getting it, but maybe surviving it, as opposed to if you're one of us, you have a bigger chance. You may not have as less of big chance of getting it, but you might die from it if you get it.
Wow.
And that's really really big. And there's a whole host of factors that play into that. So yeah, this is very important. This is extremely rampant in this country and in this world. And that's where we should start out with is why. And so for both men and women, we've got things called hormones, okay? Sex hormones. Nate, you and I, we have a lot of testosterone. Our body runs on that. And that has to do with testicular or testicle formation, sperm creation, and therefore reproduction of our species we call humans. Okay. On the flip side, women have estrogen and progesterone. That is important for the same reason. It is important to develop and maturate eggs to meet up with sperm to reproduce the species. Okay. And so the other aspect of that is the secondary organs involved with that. For men, it's the prostate. Prostate actually brings all of the sperm and then the protective and nourishing elements for sperm to get to an egg. Women have a lot of other hormones and organs like the breast to help maturate a newborn. Okay, a newborn human, and that is the main purpose of the breast. So the breasts are on the chest, and what differs between men and women when it comes to the breast is there's specific glands within a woman's breast called mammary glands. Mammary glands are little pouches that create breast milk. Okay, and it is surrounded by fat, and it's actually surrounded by ligaments. Okay, ligaments and very dense tissue. And if you ever hear everybody about ligaments, like you hear about athletes breaking their tearing their ligaments in their elbow, like the pitchers or football players tearing their knee ligaments. Those things we call ligaments are the things that physically keep our body together. Okay, it's not the steel rods, but it's like the welding material to keep the steel rods together. It's the duct tape of your body. And so, yep.
I got a question. This
Mm-hmm.
ain't got nothing to do with cancer.
Mm-hmm.
So the bigger the breast, when they get to hanging down to their nipples, that means a ligament broke in their breast.
Right.
I
So
I
that's
gotta ask that, man. I gotta ask that, man. It's just a thought. Why they get
well,
to
actually,
hang?
no, that's actually a good question. No, and the reason for that is just like rubber bands.
Mm-hmm.
Over time, the actual elasticity of the ligaments actually goes down. And when I mean elasticity, everybody, in the world of anatomy and physiology, elasticity means the ability to retain your shape. Okay, so a steel rod is very elastic. It's hard to bend a steel rod. A rubber band doesn't have a lot of elasticity. You can stretch it out, but if you overstretch it, what happens? It doesn't come back to its original shape, and that's what happens to women over time.
Okay.
Okay, and actually, that's what happens to men over time when it comes to the scrotal sac too. Okay, it's just a gradual worsening of that elasticity. But there you go.
Yeah.
But and so obviously when you have very delicate and very precise organs like that, like your mammary glands that are supposed to create milk and they're supposed to transform. They actually activate when a woman is pregnant and they get ready for the fetus, and then they have to do all this work, and then they have to regress. That takes a lot of coordination within your body, and it takes a lot of cellular changes to happen precisely. Okay. And this is what I want to get into about our body. Our body is not perfect. Okay. It is remarkable. It is a very miraculous machine, but it is by no means perfect. And things happen that mess up. And cancer can be the result of that. Because when you have a lot of that cellular change and manipulation over time, and then constant exposure it, to those sex hormones like estrogen and progesterone, that can lead to what? Cancer. Okay. And it's the same thing in men, where you have this constant influx of testosterone and changes over time, decades upon decades upon decades of it. All of a sudden, you can develop prostate cancer. Okay. And the difference between men and women in that sense is women go through a very abrupt increase in their hormones and then a very abrupt decrease in their hormones. So it's basically once a woman goes through adolescence, it's coming up, and then at about 45, 50, down, down like a rock, right? Whereas men, it's pretty much a gradual up and then a gradual decline over time. It's not as abrupt. Okay. And that is very, very tough for the body to adjust to. And that's where things can go wrong. Okay. And where do we see the majority of breast cancer in women? It's when you get to that 40, 50, 60, 70, that dramatically changing female body. Okay, everybody, it's a very delicate system, but it can go awry a lot, and that's why a lot of women get affected by this, because this is something that your body has not perfected yet. Okay, and really there's nothing perfect within your body. Yet again, this is a miraculous machine we have called the human body, but it is by no means perfect. Cars are incredibly awesome and one of the greatest inventions men have ever come up with. But it is by no means perfect.
Mm.
Okay, it's very inefficient. It's got its kinks. And it's the same thing with your body. Okay, so what we need to start with first and really diving into breast cancer outside of the functioning of the breast is, you know, who's at risk for this? Okay, who can get affected by this? And so this will kind of go out the norms, Nate, because we usually talk about smoking and this and that and this, but it's a little bit different for breast cancer. Okay, and so the number one risk factor that, and this is why families need to communicate, is what? Family history, genetics,
right?
family history. Okay, you are at very high risk if your, what we call a first degree relative. What's your first degree relative? Your parents. Okay, your siblings. If you have a sister. Okay, if, and men can rarely get it, but they get it. You got a brother. Okay, if you've got a direct blood aunt, if you've got a grandmother and your mom had it and all this other stuff, or your dad's mom had it, those are risk factors. Okay, and so, you know, they might say, well, Dr. Johnson, why is that in your DNA? Because your DNA isn't perfect. Your DNA is not perfect. Okay, gradually, as we go through the thousands of years of human existence, does it get a little better here and there? Yeah, right. And that's just as DNA mixes over time. Okay, but it is not perfect. So sometimes some women have a defect in their DNA, which all of a sudden sparks a cancerous growth, and that's just the brunt of it. Okay, and so if you've got a family history of breast cancer, tell that to your doctor. So you know me, at the heart of it, I'm a primary care provider, and I say, hey, get yourself a doctor. Tell them that. When we ask y'all about your family history, if you don't know, don't just be like, well, I just don't know. Ask. Okay? Ask. Because that's a life and death situation, you know? Because if your grandma all of a sudden died of something that we have no idea why she died of, but you may know, yeah, you know, if your mom says, yeah, grandma died of something, I just don't know. But I just remember, man, she just lost all kind of weight though, all of a sudden over the course of 6 weeks. That should be a little okay. And yet again, if you don't know, and you honestly don't know, even if your family doesn't know, tell that to your doctor. Okay, because that may be like, okay, well, if we see XYZ, maybe we need to explore, you know, you being a high risk of breast cancer. Yet again, the next thing is, like I said before, the breast work on hormones. Okay, the breast work on hormone exposure. And so another aspect of this is dense breast tissue and a massive amount of breast tissue. Okay, so that's simple odds. Okay, the more breast tissue you have, the greater your chance is of having breast cancer. Okay, that just makes sense. Okay, and specifically, you know, where people associate a lot of breast tissue at is the very visual part, but actually the most breast tissue is usually right here close to your armpit. Okay, and so yet again, if you have a lot of dense breast tissue, that's going to increase your risk. And that is why we do what we call mammograms, which I'll get into a little bit later, to evaluate those specific factors. Okay. Now, other risk factors, not only having, you know, like your direct family, but if you do have a cousin, a blood cousin that is positive, or a great aunt or an aunt that is relevant too, as far as being a breast cancer risk factor. Next step, okay, and looking at what are other things that it will associate for, you know, breast cancer risk, is not ever having kids. Okay, which is weird, because then you say, well, Dr. Johnson, you know, why is that? Because they never develop if they never have kids. True. But all of a sudden, you've just got this constant exposure, unopposed exposure to hormones. Okay. When you're pregnant, those hormones actually go up and down, up and down. Okay. And so your body gets a little break. Okay. And so there's not this direct exposure for decades upon decades. So not having kids is a risk factor. Okay. And on the flip side of that, having kids later in life, having it, at 30, 35, 40 years old is a risk factor. Why? Because you have that constant exposure from the day you become a woman. You have that constant exposure of hormones hitting you for decades upon decades. And then, so this leads into, okay, you've had all this exposure to hormones. What's another risk factor is oral birth control tablets.
Mm.
Constant exposure to estrogens over time. And yet again, this is not saying, okay, we should never put women on birth control or anything like that, because a lot of women use birth control not only for that purpose, but a lot of women use it to control their cycles, because a lot of women do have issues with their cycles where it's a lot of pain, a lot of bleeding, and then a lot of disruption to their daily living. And so those are things we've got to balance out as doctors, knowing the risk of that. Okay, and are there alternatives for that? So women, always ask your doctors, have conversations saying, hey, is this the only way to do this? Can we do other things? Can we try other means that don't require hormones? Because there are options out there. And so this is where you as a patient have to take your body into your own hands and talk to your doc and say, hey, doc, look, what is everything out there? What are the risks? What are all the options? Okay. And yet again, every doctor is different. You may have some that are standoffish to you, but even for those docs, if you present it in a very straightforward manner and not a defensive manner, then that can actually lead to a very good conversation. And that's what we call shared decision making. Okay. If you're on the same page with me, it makes my job easier and it makes your life better. Okay. Does that make sense, Nate?
Yeah, I agree with you 100% there.
Yeah, and that's something we don't see enough of, on both sides of the aisle there. It's, you and I have been patients for different things and we have a medical basis, so we know what questions to ask. But a lot of patients have that old school mentality of, hey, it's the doctor. They know everything.
Right. That's
So
why I was
whatever
just saying, they don't understand. And that's why we're doing these videos too, man, so they can see, yeah, you're a normal dude. I mean,
yeah,
you
right.
human.
I'm human. Right. I'm
You
not
have to
infallible,
know.
you know?
Right. You have to open up and talk to your doctors about what's
Right.
going on with your body. They can't read your mind.
Yeah, we can't. We can't. And you have to ask, because until you ask, and yet again with your family history, you've got to tell us that. When we ask you, hey, what medicines have you taken? It's a good thing for us to know,
Yeah.
hey, 20 years I took birth control tablets. Okay. That's a very big thing to know.
Right.
You know what
Right.
I'm saying? If
FYI for a lot of you all ladies who go to the doctor and anybody who goes to the doctor on a frequent visits, or if you newly have a new diagnosis that you got to go see a doctor a lot, write down your stuff and
yeah,
keep it in your wallet or your purse. I'm telling you, that's an easy way to get them the information, because it's very important that they have the information. You just can't leave off. I used to leave off with medicine here or medicine there. They have to know that. You know what I'm saying?
right.
They have to know that. I just want to say that, you know.
Right. And so, yet again, going into a few more risk factors other than family history and things like that. And I will say, as far as the usual stuff, and you know what I'm going to say, Nate, usual stuff is smoking, things of that nature. High level of alcohol use is not a big risk factor for it. But I am one of those people who will tell you, smoking nicotine, using nicotine at any point causes constant inflammation. Inflammation is the driver of all types of cancers. And so I'm going to tell you, don't smoke, don't use nicotine, the end, period. That's
So
the end of
does
that.
the inflammation is that's the causes of the cells to be overworking.
Right. And so that's a good question. So, basically what inflammation is, and we need to probably do a whole lecture on that. It's if you ever feel the things that make you hurt, okay? So the things that make your back hurt constantly, or when you get sick, the things that make you feel bad, it's your body's army working, and it's the chemicals your body is using to fight or rebuild that makes you feel like crap. And
Okay.
what some of these chemicals do is that they break parts of your body down and they rebuild it, right? So to fix a street, what do usually you have to do to fix a street? You have to break that section of the street and just redo it, okay? And like I said, that constant hormone exposure for cells that are always supposed to be changing and creating and recreating is a recipe for cancer. So you throw inflammation on top of that, things that make you break down and rebuild at a constant rate, day after day, month after month, year after year, decade after decade, is a recipe for cancer. Nicotine causes that breakdown and rebuilding to go into hyperdrive. Okay. Not the
Right.
and now the other stuff they put in tobacco does too, but nicotine does as well. Okay. And so that's why I want to emphasize that is just not conducive for human life is using nicotine, okay, for any like consistent basis. So just remember that, everybody. It's not just lung cancer. It's not just this. Smoking has been related to name a disease on this planet, and smoking is probably, or nicotine use is probably in there as a risk factor. Period. The end. Okay. Um, Now, on top, we were talking about other issues as far as, you know, breast cancer in the family, dense breast tissue, and things like that. But, one thing we are starting to notice is women who get breast implants, okay, um, for just cosmetic reasons, okay, now, especially with the older ones, were getting breast cancer from the chemicals they were using. But even now, there are some studies showing there is a mild increased risk of breast cancer, which kind of makes sense. If you're tearing that area up, you're causing that damage to that tissue. There's this constant scar tissue rebuilding, remodeling, and you're kind of changing the physiology or the structural functional anatomy of that part of the body, then that can yet again be a recipe for that person's breast cancer. So that's something to keep in mind. Okay. Now, how do we screen? Okay. Any thoughts on how we screen, Nate?
Always gonna be taking a picture.
Always
And then,
taking a picture, because yeah, in medicine, okay, the only way we truly can diagnose something for sure,
gotta
okay,
see it.
is seeing it. Okay. And so this is where we get into, okay, when to do what. Now, you remember, you and I were growing up, it was always that thing of, hey, let's go ahead and tell everybody to just do a self breast exam all the time, yada, yada, yada. Well, we kind of found over time that that was leading to a lot of unnecessary procedures, okay, a lot of unnecessary stress, financial burden, etc., on women, especially younger women, because younger women tend to have um, little cysts or lumps in their breast that are non-cancerous, okay, and that's just due to that at that point in your life that your physiology will cause that, okay, because usually the cancers are in late 30s and beyond, and so that's kind of gone out of favor. Now, I will
Mhm.
tell you from my opinion, and this is not gold standard or anything like that. If you feel something or your partner feels something all of a sudden that's there and it's weird, Okay, get that checked out. Okay, you could have dense breast tissue, you can have this, but if all of a sudden there's something that feels like a marble. Okay, get that checked out. Okay, better safe than sorry.
I tell you, man, if you love your woman, learn how to do a breast exam. I love doing a breast exam with my wife. I was just saying, you gotta you gotta do it, man. You love it. I want my wife going over. I gotta make sure them things are all right. You know, you gotta
Yeah,
get do the job. I'm a nurse. You gotta go in there and do your thing, man.
right, right.
And, hey,
Yeah,
you
hey,
never know what might happen afterwards, but hey, you gotta check your wife out and make sure she's gonna be around. Let's grow old together, and
that's right.
yeah,
That's right.
you know.
And let's not downplay that. We joke about that, but let's not downplay that. Breasts are essential for life. Everybody, breasts are essential for healthy development of a newborn. I know we have formula and all that good stuff, but guys, breast milk is
Like person.
exactly what we're supposed to have, and it is. I mean, there's a myriad of health benefits for infants compared to infants that just get formula. Okay, and there's not even competition. There's just not. Okay, it just and that should make sense. Everybody, I mean, it really should. So it is very extremely important.
Why did they come out? Did you ever do a study on that? You got some information on that? Why did they come out with a supplement? Was it some
Yeah,
baby?
so that's a good question. So, like I said, it's not a perfect system, and not everybody produces one may not produce breast milk
Right.
properly or enough breast milk,
Was
or
it was it a conspiracy?
no, no, no.
Trying to start something, man. Is it a
and then
conspiracy?
and then there's some
Breast
issues
milk
there.
conspiracy. Yeah.
And then there's some issues where the newborns don't latch on to the breast, okay, and have the right supplement. Or there's some babies that are born with anomalies, functional anatomy anomalies, where they physically just can't. And
Like
so that's
we get the babies born with the clipper, all that kind of stuff.
right, right.
Stuff
You
going
know,
on.
and then there are issues where some babies just cannot handle it. Okay, so there's a definite place for formula. Uh, the widespread use of it is probably what's getting a lot of our youth for the past, probably, I would say, 2 or 3 generations. Okay, and then too, on top of that, right? Now we're at a place, a good place in society where women are a part of the society, and hopefully one day equal footing to men. But getting to a place where women have successful careers, they've got work, they've got jobs, and breastfeeding is a pain in the butt. Okay,
It's not just the working women. Now you know some of these chicks at the crib, they don't want to just
right, right.
he ain't
That's a
latched
whole other.
on. You ain't sucking on my thing. It hurts. And they tend to, I
Right.
already know. Chick ain't trying to do that.
Right, right. And because you have a lot of hardworking women that got 9 to 5s, and breastfeeding, they just can't do it because
You got the
at the end of
time.
the day, you got to put food on the table, you got to get bills paid, etc. Also, you've
Yeah.
got leaders of this world who making high level decisions every single day, every single minute. Okay, and may not be able to do that for a long period of time. So yeah, there's a lot of reasons why. Now, there are some reasons that women use that are dumb. Okay. And then there are some cultural things too, because some people think, in some cultures, if you breastfeed, that means you're poor. Okay.
Right.
What's just dumb? I mean, having a kid is expensive enough. Uh, and
Yeah.
formula is expensive.
What? Yeah. What bracket you in nowadays?
Right.
Sure.
But overall, though, it's extremely important to life on this planet, and for us to go on through the generations. So, now that's a random sidebar. Now, back to actual screening. So the way we do it is uh, all women should get a yearly physical. Okay, a yearly physical, just to say, hey, I'm doing okay, everything's okay. Let's assess things and things of that nature. If you are 20, 30 years old, you've got a lot of risk factors that we talked about, and there are a few others I didn't mention, but Nate, you had put it on the bottom bar. If you have those things, you may need to talk to your doctor, and your doctor may suggest, hey, let's just go ahead, let's do breast cancer screening by getting a mammogram. Okay, and a
Right.
mammogram is a specific ultrasound where we get sound waves going into the breast tissue and kind of light up the breast tissue, kind of get the shadows of the different glands and everything. We just try to see anything abnormal. Okay. Now, a lot of times we will see like little cysts and things like that, but like I said, younger women tend to have these benign cysts. Women in general just have these very dense areas that are just benign or non-cancerous cysts. Um, when you're in your 30s, it's the same thing. You really have to talk to your doctor and be like, hey, am I at high risk? Am I this, and that? And it's relevant at that point to get screened if you do fall into a certain risk category. Okay. Now, if you've got a family history of it, just like with colon cancer that we went over, get as much information as you can. Okay. Because that helps your doc out. Get as much information as you can. Ask that person that had breast cancer, or if you can remember, okay, my mom had breast cancer. My sister had breast cancer at 30 years old. Okay. You need to get screened before you're 30. Okay. You need to get assessed for your genetics to make sure this isn't a genetic component. Because remember, like I talked with pancreatic cancer, there's a lot of genetic components to that. And if there's some genetic component to your breast cancer, you need to get evaluated for pancreatic cancer risk as well. Okay. You probably need to go to a geneticist and ask, hey, let's map all this out. All right. And that is a very, very important thing. So, yet again, like we've talked about in private, Nate, it's families talking to each other about their health is
Right.
extremely important. Okay. So, notice how we did for colon cancer and pancreatic cancer. Guys, the if we can prevent it, that's going to save your life. Okay.
Hmm.
And on a selfish side, if you tell me everything you can about your social history, family history, your own medical history, your medications you use, the drugs you use, I'm gonna say this selfishly, that makes my job a whole lot easier because I know what I'm going to deal with, and I'm not going to have any surprises,
Right.
or I'm going to limit the chance of surprises. Okay.
Right. Right.
Um, and just like with colon cancer, hey, if I know your dad, uncle, whatever had colon cancer and he was 40, well, man, you need to start getting colonoscopies when you're like 30. Okay. You
Right.
need to get eval now. And that's the same thing with breast cancer. Knowing the timeline, really talking is what you need to do. Now, when you're in your 40s and stuff and you've had no kids, or you just had a kid maybe 5 years prior, or you've been on birth control for decades that require hormones. Now, what I mean by birth control, I really do mean just the pills are very high dose, um, hormone based birth control. But the copper IUDs and the diaphragms and things of that nature that don't require hormones, we're not talking about those. So I want to make that big distinction. Okay. If you've used that for decades upon decades, whew, let's talk about getting you screened. Okay. Let's talk about getting you screened. And that's one of the things you have to be comfortable with talking to your doctor. Okay. Because, and Nate, back me up on this. Everybody, you're not going to tell any medical professional some name they haven't heard of, learned about, seen, whatever. It's hard to freak us out. It really
Right.
is hard to freak us out. We don't care.
And
Okay.
heard so
But
much, and
yeah,
seen so much. It's
Yeah,
Yeah.
like when I deal with, a lot of my HIV patients, or dealing with young people and sexual health and stuff like that, I start off the conversation and be like, "Look, I ain't going to Twitter, I ain't going to Instagram. I really don't care what you do, okay, unless it affects somebody else. But I'm here to get as much information as possible. I'm not going to judge you, nothing, okay."
Right.
So, if you got breast implants because you wanted to have breast implants, all right, cool. As long as you tell me, I'll tell
Yeah.
you when you do something stupid. Like I'll
Right.
tell. Well, maybe you shouldn't have. If you got hepatitis C all of a sudden, it was like, well, maybe you shouldn't have got that tattoo in prison, bro. All right, you know.
That's what I tell y'all. Y'all need to email some questions and ask this doctor some questions. 'Cause later on, he ain't gonna be available once he start getting real busy like this. You gotta take this stuff you're doing for free.
Right,
You
man.
take it
So
over and you say we're not getting paid for that stuff. We're doing this for you all.
right,
Save your life. Save
yeah,
somebody's life that you love. Because you always can go to the page daily, daily medicine, to come to my page, and we got plenty of videos we posting up weekly from the past. I think we did about 10 of them. I think we got about 4 of them airing right now, maybe 5. I don't know, but y'all need to take heed to these jewels this doctor's dropping for free.
yeah, yeah.
or just go see him in the clinic and go and pay the $200 visit fee.
Right. Tell you to stay.
You can ask me right now. Yeah. Right now, get the email shot back to you. I don't understand. Yeah, Doc. I just had to throw that out there because
Yeah. And you know,
we trying to go ahead, Doc. I'm sorry. I'm trying to see what I'm gonna
oh
put
yeah.
on here.
So once we get, and yet again, once you get to 45, 50 years old, that's when we start just, doing mammograms just outright. Okay.
Yeah.
Just to keep surveillance on the tissue. And we'll really do that until you're beyond 75 or so. Okay. Now,
All right.
once you get into your 80s and such, just like with any cancer, that's when we have a discussion. Okay, we've got a positive mammogram, or even before that, even if we're going to get a mammogram, or do we want to do anything about it? And yet again, that's a conversation you should have with your doctor. Okay. And
All
then
right.
for a lot of my colleagues, that's a conversation you need to have with patients. It's a crappy conversation, but it's a very legitimate one. Okay. Because you have to know what somebody wants. Why? Because, myself and Nate, we cannot read your mind. Okay.
Right.
Because if I'm going to do a mammogram, that means I'm going to assume you want to do a biopsy, you want to do treatment, surgery, radiation, chemotherapy. But from the jump, if you just say, "Hey, doc, I don't want to do any of that," all right, cool. You tell me if something weird's going on. You know what I'm saying? And we leave it at that. Okay.
Right.
Same thing with colon cancer. It's like if you say, "Hey, doc, look, if I get colon cancer, I don't care." You know, all right, cool. All right, you just tell me, if you want to do something about it because something's weird is going on, and that's a
Right.
legit thing. But in between that, there's a lot of stuff we can do, a lot of things we can do to screen and prevent. And when we screen, we usually
Right.
just go ahead and do the mammogram first, okay? And then a lot of times, if we see something abnormal, we'll all of a sudden just say, okay, let's get an ultrasound or another detailed scan of it. Maybe set you up to get a biopsy, which means we're just going to go in, numb the area, get a chunk of that tissue, maybe get what we call a lymph node out to evaluate that to see what is going on. And hopefully it's nothing. Okay, but if it is something, at least at that point, we know what it is, how to treat it, and where it's going. Okay.
Right.
Now, from the anatomy standpoint, when I'm talking about lymph nodes, and I've said this in other uh, cancer talks, is lymph nodes are the small highways that we use to get rid of extra fluid that may spill out of your veins and arteries. Okay. And
Mhm.
that's how we just get it back to your heart to get it recirculated with your blood. So I always use the comparison. I-55 big interstates are your veins and arteries. Okay, that frontage road, that small frontage road, or that
Mm-hmm.
little byway. Okay, that's your lymph nodes. Right, right. It's gonna be a longer route. Okay, but you still gonna get to the same destination. Okay,
Okay.
and because just remember what happens if all of a sudden I-55 is blocked off, I-10 is blocked off. You can use a frontage road,
Right.
okay, to get there. And that's how you have to consider the lymph nodes. And that's how a lot of these cancers get to the rest of your body, is through those lymph nodes. And so for your breast, if we have right here your breast tissue, the lymph nodes that are the frontage roads for your breast are in your armpit. Okay.
Mm-hmm.
They go into your armpit. So if you ever have a doctor that's digging into your armpit or something when doing a breast exam, he's looking for the lymph nodes. Okay. And like I said, the most breast tissue is actually in the upper corner. Okay. So that's why we dig around and we're going under your chest muscle called the pec, and we're going into your armpit, make sure those lymph nodes aren't swollen. Because if they're swollen, that's an issue. Okay. And we need to
Right.
figure out, okay, maybe there's something going on. All right. And so that's why on a biopsy, they'll go ahead and get a piece of the lymph node too, to make sure there's no cancerous cells there. Okay.
Right.
Because if they determine it's cancer and there's cancerous cells there, that's when you're just going to get a bunch of scans to look at all the other organs. Okay. And usually if cancer is spreading from the breast, it's usually going to end up going into the lungs first, because those lymph nodes here actually just dump right into your heart. And then the first big organ that soaks that blood up and fluid is your lungs. Okay. So that's why you'll see, mom
Right.
had
Spread to the lung
cancer
first.
and it spread to the lungs. And then after that,
Yeah.
a lot of
Yeah.
people tend to get brain
Yeah.
metastasis or
Yeah.
brain cancer from it. Why? Because 75% of the fluid that comes out of your heart goes to the brain. So statistically, your
Mm.
brain is more likely to start growing first. Now, colon
Wow.
cancer.
Wow. That's crazy. I
Right,
know.
colon cancer. Okay, so depending on where part of the colon is, but for the most part, yet again, it's a seeding method. So you're just going to go to the next organ that's up first. And a lot of times with colon cancer, the first place it spreads is the liver. Why? Because remember, everything you eat, drink, consume that goes from your stomach to your rectum gets absorbed into your blood. All that blood that's absorbed from your guts goes, for the most part, goes to your liver. Okay.
Mm.
And that's why the liver is usually the first to get hit. Okay.
Wow.
And
Okay.
then the lungs, and then the heart, and then everywhere else. And so now that's not saying you don't see other things with, breast cancer too, because you certainly do get bone metastasis or bone cancer with breast cancer as well. One of my favorite patients, starting out once I got to Brookhaven, passed away from resistant and recurrent breast cancer, and it got to her bones. You know,
Mm.
and that's just because even though most blood is going to the brain, it goes to the rest of your body too.
Mm.
Okay, and especially if there's a lot of response to estrogen and things of that nature, your bones in women respond to estrogen. Okay, so they soak it up like a sponge. So those cells can get into the bones pretty easily. Okay,
Right.
because what do we hear about women getting after menopause is breaks and hip fractures caused by osteoporosis. And it's
Yeah.
because of that abrupt drop in estrogen that is pretty much like the architect of building and keeping bones hard. Okay. And yet again, that's why I say it's a good, great system. It's not a perfect system. Okay. In men, even though it's not abrupt, it's still a drop. Men still get osteoporosis as well. Why? Because our testosterone goes down, and we use testosterone to build our bones and muscles up too. But it's just not as abrupt as women. Okay. That's why you see men had, you ever met those dudes, Nate? They're like 55, 60 years old having a newborn.
Right. Yeah.
Because men can still produce sperm. It's not the greatest sperm by all means, but they can still do
That's
it.
when maybe come out looking old.
Yeah.
Maybe come out looking like he on
Coming
Social
out.
Security.
Right. Already on
I
that
got my
hair.
bottle. And my bottle ready. Grown ass baby. No. You say women.
Baby talking about
You say women. That's why I tell my wife, man, she turned 45. I said, your place is at home in the kitchen. You don't need to be out there working so damn hard.
How did that conversation go?
She at work right now. I get away from your ass. Boy. Yeah, I'm too silly. I get away from you, man. I don't even like going to work. I'm going to work to get away from you. You know you ain't gotta go to work. You gotta leave the other way from me every day.
But yeah, I think that's enough information from my standpoint today. I definitely want to do a few more of these this month because there's a lot more things we could get into. We get into specific types of cancer, things to look for at home, and things of that nature. Because yet again, this is very complicated disease. Is a very complicated treatment, but it's because it's a very rampant disease that we have to get on top of.
Pamela McGee said, y'all wrong. All wrong. What we wrong about, Miss Pam?
Hey, Miss Pam.
But yeah, so this has been another episode of the Daily Medicine. Y'all can continue to send all these pouring questions that I'm not getting whenever you all feel like it. To pick up though. I always get the phone calls after the episodes, and I just get on the next one. Y'all been great, Doc. Appreciate y'all. Where we doing prostate? Y'all hear from the doc. He the one told me he got a. One thing about a doctor, he goes to his busy schedule to come out, and I know how busy he is. I don't know if he want us to tell, but talking about them old babies. They do. Doggone well, y'all seen them little babies out there that look old. That then the daddy be about 60. The
Look,
baby be 5.
Look,
Baby be in the 5th grade.
hey, my dad is 81 years old. I'm just saying. And I'm not 40.
Old baby. Look at all that. Y'all got some liver cheese and crackers. Dog, gotta be having snack time. Y'all got some liver cheese and crackers. That one ain't for no regular damn snacks. Old ass baby.
Oh God.
Yeah, y'all need to turn Matlock on. I ain't got Matlock on for lunch. You watching Matlock?
Matlock. No, Matlock in the heat of the night.
Right, yeah. Yeah, I watch Heat of the Night. I love that. I love that boy. That doggone cop and all them racist.
Man, that's an underrated show, bro.
Yeah, it is. It is. I sure went looking for where they filmed it at, but they found out they didn't film it in Mississippi. I thought they filmed it. There ain't no Spartan, Mississippi. I went try to get on one of them episodes. No, I didn't do that, sir. With me, sir. I'm sorry. Hey, this has been the Daily Leader. Peace. Oh man, this thing don't want to end. Here we go.